Hi, everyone. Welcome. This is the second episode of season 5 of Love Plants, where my guest joins me for a chat on the gut microbiome, gut health, plant-based foods, and overall health and well-being. And it is my great pleasure today to be chatting with Dr. Krystle Zuniga. She is a board-certified oncology dietitian, and we will be talking about a topic that comes up a lot on social media, a claim that is both confusing and, has a lot of nuance, this idea that sugar feeds cancer. And I know, Krystle, that you're you have strong feelings about this. And I was very excited that you offered to join me for this chat today. So thank you so much.
Yes, anytime I have the opportunity to talk about this, get into a little bit more of the nuance, I appreciate it.
Exactly. So before we get started, I wanted to hear a little bit more about you. What prompted you to go into dietetics and specifically oncology, nutrition, and also why you are so passionate and you think it's important to share health information and science information on social media?
Yeah, when I went to school, I was not intending to be an oncology dietitian. I just had an opportunity to help one of my mentors in her research, and she was doing research related to diet and cancer. And that really sparked my interest to see how diet could help with something so complex and complicated. So that's when I went on to get my PhD in nutrition, was doing some research related to diet and cancer. And so then I wanted to combine that with my dietetics background to serve cancer survivors. Because there is so much misinformation out there. As I started working with cancer survivors and seeing the questions that they were coming to me with, like, where are they hearing this?
Mm-hmm.
Right. And so a lot of it was on social media or maybe in their Facebook support groups. And I was realizing that a lot of people don't get access to nutrition support when they're going through cancer treatment and they're looking for information online. And unfortunately, it's not always good information online. And not only can that information be incorrect, it can be harmful if it's leading a survivor to pursue dietary patterns that really aren't going to be supportive of their health during cancer treatment. So, like, well, I have the knowledge, I have the experience. Why not share that information online?
Yeah, and I think, and you're doing a fantastic job, and you're right. It's filling a void because oftentimes the misleading information or these claims that have some science, some scientific background and strength, but then they're amplified by a lot of misconception and misleading information. And it's important to have people who provide evidence-based information on social media. So I really appreciate your work.
Thank you.
And we're going to get started with the word sugar, since, this is the topic of the conversation. What is, one person, when they think of the word sugar, what usually comes to mind? And then from as a nutritional term, what is the difference? What does sugar actually mean as a nutritional term?
Yeah, I feel like when people think sugar, they're often thinking of table sugar or added sugars in the diet. But when we talk about sugars, that's under the umbrella of carbohydrates, right? And so we have three major sugars, monosaccharides, because they're one single sugar molecule. We have glucose, fructose, and galactose. And table sugar, which is sucrose, is made up of glucose and fructose. But sugar is not the only place where we're getting those glucose molecules. So glucose is a preferred fuel source of all of our cells because it's a very rapid source of energy. We can get energy very quickly from these molecules. But again, it's not just table sugar that's providing these sugar molecules. We also get carbohydrates from our grains and from fruits and vegetables and beans and legumes. So we want to consume those foods that contain those glucose molecules.
Exactly. So that is starting to paint the picture of why this idea that sugar is bad for cancer is very complicated, because we're getting sugar or sugar molecules or carbohydrates from all sorts of different foods. Okay, so no, so now the other thing, what is cancer in simple terms, so that then we can explain this connection with sugar. What is cancer, and then how did this idea that sugar feeds cancer cells come about?
Great. So cancer, simply put, is when a cell is dividing uncontrollably. We have mechanisms in place that should tell a cell, okay, we don't need you to divide anymore. We're good. We don't need any more cells. But unfortunately, cancer cells could ignore those signals. Or there are signals that say, okay, you're actually a damaged cell. You're not a good functional cell. You should die. And cancer cells also find ways to evade that. So these cells that are damaged continue to replicate and acquire more mutations. And because they are replicating so quickly, they do require a lot of fuel. You can't divide and without energy. So yes, we do see, and this is back into the 1920s, Otto Warburg discovered that cancer cells do pick up glucose more quickly and utilize glucose as a preferred fuel source compared to normal cells. And that makes sense because they are dividing really rapidly. They need a lot of fuel. Glucose is a very rapid fuel source. Also, glucose is necessary for another pathway we have in cells that makes the sugar molecules that are the backbone of our DNA and RNA. So when a cell divides, it's going to need to make DNA, RNA, and so glucose is also providing the building blocks for that. So then the theory kind of came, well, then if you're eating more carbohydrates, then essentially you are fueling cancer cells because they are using that glucose to divide, make their DNA as well. So that's kind of where it initially stemmed from.
It got confusing, exactly. But but of course, we know that all cells need sugar, of course, normal cells and cancer cells, and they all use it as their fuel. So, is there any way that the cancer cells use the glucose differently? That would, that would fit in with the claim?
Mm-hmm. Right. So all cells like to use glucose for fuel. And in fact, our cells of our nervous system, so our brain, really like to use it because think about how many decisions our brain is making. It really helps provide a really rapid fuel source for the brain. And also, our red blood cells cannot use anything else other than glucose for a fuel source. So all cells, again, in the body can use glucose. And so then again, back to this theory, it's like, well, then if you cut out carbs, then you could starve the cancer. Well, because glucose is such an important fuel source for our body, even if you eat no carbohydrates, none at all, our body can actually make glucose. And it will make glucose because it needs to maintain our blood glucose levels in a pretty tight range, about 70 to 100 is what we consider normal. So if it drops below that, our liver will make glucose, or the liver actually stores some glucose and it'll release that. And it will make glucose out of some other precursors we have in the body. It actually really likes to use amino acids, which make up proteins in your muscle, right? So that can be used to make glucose. So again, it's such an important fuel source that if you don't eat it, our body will make it.
Okay. Yeah. And you couldn't survive if you didn't have it as a source. So that's why the body has all these pathways to compensate, obviously, for the lack of it. So you couldn't potentially be isolating the tumor cells to starve them simply by removing sugars from your diet.
Right. Because they're all getting the same blood supply, right? The same circulatory system. So it's going to see glucose. It's going to pass by the muscles. Muscles will pick up glucose. Your liver, your kidney, right, are seeing the same blood supply and will take up the glucose that it needs. And also, we've seen that because cancer wants to survive so much that it can develop, or eventually it can have that selection, right? So the cells that did require a lot of glucose and can't live without it, if glucose levels drop, they're not going to do so well. But the cancer cells that have mutations that allow it to use other fuel sources can continue to thrive. So they can use, we've seen that they can use ketones for energy. Some can use fatty acids really well for energy. Some really like to use some specific amino acids for energy. So it is unfortunately able to get fuel in other ways so that it can continue to survive.
Right, right. So there's no evidence, scientific evidence that has shown when someone goes sugar-free or even, cuts carbohydrates altogether, that the tumor growth is diminished or that stops altogether.
Right. I'll say with some like a couple of caveats, there has been a little bit of research in, I won't say little, I like where the focus has been in brain cancers, because yes, they do utilize a lot of fuel, maybe not as well as using ketones, and it might help in combination with therapy. So yes, we haven't seen any evidence that going on a ketogenic diet and that being the only therapy is going to support killing that cancer, but maybe in combination with some certain therapies and some certain cancer types that have certain mutations, it might be a beneficial in adjunct with it. So again,
Yeah.
a lot of caveats there. It's like, well, it has to have this specific mutation and in this type of cell type. It might be able to be used in addition to some
Right.
therapies.
And I think that's very important to stress that is generally it would be in addition to other type of therapy, and it's also not something that a person with cancer would be deciding by themselves, that it might be good, it might help if I start, quit all sugar or all carbohydrates from my diet, because in fact, how would that affect the rest of the body while someone is receiving treatment?
Yes, so we know during cancer treatment, energy needs are higher. Many of these cancer therapies, like chemotherapy, are killing healthy cells as well. So for those cells, or damaging them, so there's going to be required energy to either clear the damaged cells for new healthy cells, to replace those damaged cells as well. And that's a lot of energy demand. So when someone is restricting carbohydrates, my concern is always, well, where else are you going to get your energy from? And are you going to be able to get enough energy with all of these restrictions in your diet? Another concern as well is, well, where, as we talked about at the beginning, carbohydrates coming from? Our fruits, our vegetables, our beans, legumes, these are also foods that have fiber. And fiber helps support our microbiome, and that also helps lower inflammation and support our immune function. These plant foods are also really good sources of antioxidants, things that are also helping lower inflammation. So by following a diet that's being very restrictive on carbohydrates, we're actually also going to reduce diversity in the diet, going to reduce fiber intake, going to reduce the intake of essential vitamins, minerals, phytochemicals, antioxidants that actually help support the body in cancer treatment.
Exactly. Yeah. And also, I feel like we are adding on another level of stress to a person who's already worrying about so much and undergoing treatment. Adding a restriction that is not even evidence-based would be right. Adding another thing that they have to deal with. On top of that, I would imagine, and you can add to this. A lot of times, carbohydrates are a quick source of energy also, and also palatable, like something easy for someone who's undergoing treatment. So by having that restriction can be an extra obstacle, right?
Yes, with so many potential side effects of these therapies, I always like to encourage my patients to have as much diversity in their diet as possible, because you don't know how you're going to feel from one day to the next, and what foods are going to be able to tolerate either the taste of, the texture of, what your GI tract can handle. And yes, I often hear that carbohydrates are often the basis because they're bland, they're easy to eat. They're easy to digest, and that can just be something that's more tolerable at times where their side effects are kind of getting the best of them. So yeah, we want to have that diversity. No, I don't want your diet to be 100% simple carbohydrates, but there is a time and a place where those are going to be the fuel sources that you can get down at that time. And the other concern, yes, you talked about lowered energy because you have less carbohydrate. But if you are losing weight because you have so many dietary restrictions and you're not able to meet your nutritional needs, we know that malnutrition is a risk factor for poor treatment outcomes, more treatment toxicities. So we're really trying to, again, have as much diversity in the diet as possible so that you have the opportunity to meet your nutritional needs, because malnutrition is not going to support your health or the outcomes of your treatment.